Yes, but at the end of the day, you're going to have a very lovely career because not many people can do what you can do as a surgeon. Hello and welcome back to my YouTube channel. You're new here. Thank you very much for showing up and try to subscribe to this channel and you would love it. If you're returning, thank you so much for coming back. My name is Margaret and I am a plastic surgeon living and practicing currently in Nigeria. On this channel, I share videos that focus on entrepreneurship, on healthcare, and lifestyle issues in general. So without much ado, I would like to dive into the subject of today's video. So today's topic is going to be how to become a surgeon in Nigeria. For you to be a surgeon in Nigeria, obviously, you have to have a medical degree. And what do I mean by medical degree? That's a bachelor's in medicine in Nigeria currently. We have what we call the Bachelor of Medicine and the Bachelor of Surgery. So now, once you get that, there's a compulsory 1 year internship. The purpose of that internship is for you to attach yourself to a hospital, get to work and rotate in different departments, see what the doctors do and how they do it, learn basic things like putting a line, cannula to administer drugs and fluids to patients. You also want to learn how to do simple stitching of wounds and all that. You need to know how to calculate the drug requirement of a patient, how to take care of a patient in general, from the time the patient comes to the hospital to the time the patient goes home. So you need to learn all of that. And while you're doing that, you're doing it under strict supervision. Under strict supervision. You learn how to take calls. Basically, it is patterned to introduce you to the life of a doctor. Now, after that 1 year, you go for a 1 year compulsory youth service corps in Nigeria. This video is actually for people who want to do surgical practice in Nigeria. But if you find use for it and you're living outside of Nigeria, you can pick one or two gems from this video as well. So in Nigeria, we have what we call the 1 year compulsory National Youth Service Corps, which is for every graduate from a university, provided you are within a certain age range. I can't remember the age range. I think it's under 30 or something like that. I will check. But anybody in Nigeria understands what I'm talking about. So you have to do that 1 year attachment. Usually you can be sent to any hospital, but mostly you go to the underserved regions of the country where now you're going to be working a little bit more independently, but still under strict supervision. Now, after that, you start looking either to working as a general practitioner, which means you don't have a particular specialty of interest, or you go into a field of specialization. There are many fields of specialization. I'm going to link some of the fields of specialization under this video, but for this video, we are going to be talking about the surgical field. That's surgery in general. So before you are admitted into any program in any hospital that you're going to do residency training in surgery, you have to pass what is called the primaries examination. For this examination, there are two examining bodies. One is the West African College of Surgeons. The other is the National Postgraduate Medical College of Nigeria. These two colleges offer the primaries exam. Now, this primaries exam is given to you to test and see if you can meet with the cutoff to enter into a surgery residency program. So you write the exam. You can either write one of each or you can write both to maximize your chances. So after this exam, if you have passed, with this, you can apply for a placement in any hospital anywhere in the country. What guides the choice of hospital is an individual matter and also based on the space availability in the hospital, because you may like a particular hospital and there is no space in that hospital at that particular time. You're not going to wait for an extra year while your colleagues have gone ahead of you. You're going to want to do it in another hospital. You can start and you can change hospitals later, or you can decide to wait for that hospital. So people choose hospitals based on the closeness to family, where they can have family support, or where maybe the spouse lives in a particular place, they want to do their residency training in a particular environment. So regardless of what it is, you choose a hospital, send in your application, furnish them with the result of your primary examination, and you are taken. Let's say you are taken now. You go into the surgery training. The surgery training is divided into two parts. The first part is the junior residency training. The second part is the senior residency training. The junior residency training leads to what is called membership. The senior residency training leads to what is known as the fellowship, and that is the termination point of your entire training as a specialist doctor in Nigeria. So for the junior residents, when you enter into a department, you do what we call rotations. You may have been conversant with rotations when you were in the medical school. Rotations involve going to a particular department, working with them as a staff, understanding what they do, following the way they do things, following the protocol of management of their patients, managing patients alongside the senior doctors, doing some surgical procedures under supervision. Usually you're expected to watch, that's observe the surgeon, assist, do under supervision before you can do alone. Most people don't get to do surgeries on their own until they get to the senior registrar level. That's after the junior residency training. But in some hospitals, especially hospitals where the staff strength is not very much, it's not very high, you may get to do a lot of procedures early because you get to be exposed to a lot of procedures and you get to do things independently earlier than those who are in hospitals that are very large. Now, that can also be a point to help you and guide you in your choice. If you want to be a surgeon, I think sometimes it's good to also choose a hospital that is not too big, even though you may not be living in a mega city like Lagos or Abuja, but you get to do more hands-on, more skills earlier in your career. So in surgery, some departments have decided to start the surgical training in their subspecialties very early on. For instance, neurosurgery, but you will still have to do rotations in other subspecialties. Remember that going into surgery does not mean you're going to be a surgeon in everything. Surgery also has subdivisions. We have neurosurgery, cardiothoracic surgery, plastic surgery, which is my subspecialty. You have general surgery, you have urology, pediatric surgery, and a gamut of others, orthopedic surgery, you have trauma surgeon, you have all these subspecialties. So sometimes you may have it in mind that this is your subspecialty. In my own case, I had it in mind that I was going to be a plastic surgeon from day one. But some people do not have that in mind, and it's okay. Or you may have an idea that you want to be a neurosurgeon along the line, following your rotations, you fall in love with, say, urology or orthopedic surgery, and you change your mind about it. There is nothing set in stone. Now, you do your rotations, and the rotation will be determined by the specification of the colleges. Remember the two colleges I mentioned, they are going to be the ones guiding you through your entire training as a surgeon until you qualify and become a surgeon. So you can do your postings and rotations in orthopedic surgery. I think it used to be 3 months in my time. General surgery used to be 6 month rotation, and we had urology, where you take care of men and their reproductive health needs, and men who cannot pass urine properly. Maybe they have some problems or illnesses in the urinary tract or reproductive tract. That's for urology. Orthopedic surgeons are the ones that take care of people who have fractures, they have accidents or fractures, or children who have developmental bone problems. If that is your interest, you may want to go into that. I'm going to make a separate video to discuss the different surgical subspecialties, the personality you need to have, and the work-life balance. So if you're interested in those kinds of videos, so please comment down below so that I can go ahead and make this video, because it's going to help you in your career choice. And as you know, your career choice can make or break you in life. You have neurosurgery, somebody has an accident and the blood collects inside the brain, and you want to go in immediately, open that brain and evacuate that blood so that the person has a chance at life, and so many other problems. This is me being simplistic. Like I said, this is not the video for that. I'm going to make another video to discuss the difference of specialties in surgery and also the difference of specialties in medical practice as a whole. At the end of your training as a junior resident, you're expected to pass the Part 1 exam, which is also known as the membership exam. You can either do one college or two colleges. Like I said before, the West African College of Surgeons or the National Postgraduate Medical College of Nigeria. So the other one covers the whole of West Africa, the other one covers Nigeria, but both are the same. None is superior to the other. So you can either do one of them or you can do both to maximize your chances. The exam entails a lot of things. You're going to have a written part of the exam. You're going to have a clinical part where you demonstrate your ability to communicate with the patient, your ability to examine the patient properly, your ability to come to a conclusion and make an appropriate diagnosis, and develop a treatment plan for the patients. You should be able to cover all of this in that exam. And when you're done with that exam, you pass that exam, you are conferred with a membership of the West African College of Surgeons or membership of the National Postgraduate Medical College of Nigeria. Now that result now enables you to proceed to the next stage of your training, which is what we call the senior residency. Now the senior residency program, by this time, based on all your rotations, based on your preconceived notions, by now you should know the subspecialty that you want in your life or that you want to spend your life practicing. So, say you want to be an orthopedic surgeon. At this point in time, you're going to be working strictly in the orthopedic line. A plastic surgeon, by now, you're going to be working strictly in plastic surgery. You're still going to be working under supervision of the team leader, who is usually a consultant, who is somebody who has also gone through this training and has completed this training and is now running the team of which you are a part of. You're going to be working with nurses. Some of them are specialized in that field. You're going to be working with a whole lot of other staff as well. So as a surgeon in training, you're expected to have done a lot of minor operations on your own. Nobody expects you to do mind-blowing surgery at that level. So you're going to be assisting your consultant to do certain cases. You're going to be assisting the consultant. You're going to be observing the consultant. You're going to be performing under observation while the consultant is assisting you, and then you can perform while he stands in the room. Sometimes and then finally, you get to perform the surgery on your own while he is outside or not even in the hospital at all. Not every procedure goes through all of this. Some procedures are so minor that the very first thing you do, you assist, and then you get conversant with the procedure and you start doing it on your own. But some procedures, especially the very major ones, of which every subspecialty has their own variety of major surgeries, you need to go through all these processes to get to the level where you can operate without supervision. So that is the aim. Now, while you're doing this, you're also gathering a lot of knowledge. You're doing ward rounds. You are coordinating the affairs of the unit, because bear in mind that the Part 2 exam is not just to assess your knowledge and your skill. It's also to assess you as a leader of a team. So you are expected to have some skills that you can use in leading a team. You're supposed to have skills of conflict resolution, because you're going to have juniors working under you at this point in time. And you're expected to also know how to, the patients that you should take to theater and the patients that you should not take to theater under any circumstance. Now, some cases, some patients are worse off when you go to theater. So you have to know how to balance all those things. So after that, you present yourself for the examination. I did not mention that the Part 1 exam, which is the membership, you require 3 years of training currently. That means 36 months of training to qualify for both of the colleges. Now, the senior residency ranges from 3 to 5 years. Some subspecialties like neurosurgery, cardiothoracic surgery tend to be a little longer. So they may get up to 5 years before you are qualified to write the exam that makes you a fellow in that college, which means the exit exam, separating the boys from the men. So at that point in time, you present yourself for the exam, and you're also examined just as you were in the membership. You're going to be tested on the written exam of the pathology. You're going to develop a treatment plan, manage your patient to conclusion, manage all the complications that may arise. Not there at the exam, you discuss it. You're also expected to have written a dissertation, picking a particular topic in that field. You write a dissertation and defend that dissertation. When you have passed the dissertation, passed the clinical aspect, passed the written exam, you are deemed to have passed. You may require more than one attempt to write this exam to pass, but don't worry. If you put in the work, you can make it in the first attempt. A lot of people make it in their very first attempt at each of the exams. So after this, you are conferred with the fellowship of the West African College of Surgeons, and also the fellowship of the Medical Postgraduate College of Nigeria. Each of them, none is superior to the other. You can get any of them. You can decide to work on any of them, because at that point, you are now eligible to be employed by any facility as a consultant. You are not made into a consultant because you passed the exam. The exam gives you what is known as a fellowship, while the consultant is an appointment that you can secure if you have a fellowship. So I hope I've been able to cover most of what you require in your journey. So if surgery is a subspecialty that you are thinking of or that you have ever considered in your life to work in, I think you should go for it. And bear in mind that these are the steps that you need to go through. Now, what are the characteristics you need to be a surgeon? You have to be, number one, very diligent. You have to be hardworking. You have to be willing to put in the work. It's easy for us to encourage people and tell them just do it, but truly and honestly, for you to be a surgeon, you have to be uncompromising in your principles. You have to be diligent. You have to be hardworking. You have to be somebody who is available to put in the work. It's fun, yes, but it's also tedious work. Tedious work because for somebody to put their life in your hand at their most vulnerable moment, then that means you have to equip the skill to be equipped with the skills to be able to handle people at that point in their lives. You also have to be somebody who can go for long hours without the comforts, creature comforts of life, because throughout your training period, you're going to have to forgo a lot of things. Yes, but at the end of the day, you're going to have a very lovely career because not many people can do what you can do as a surgeon. So if it's a career that you're considering, go for it. Thank you very much for stopping by. Please subscribe for more amazing content. Bye.